We know Canada's healthcare system, it is broken right now. What can we do? That's the big question. According to the Canadian Medical Association Journal, look at that number, 6.5 million people in this country do not have a family doctor. And because of mass staffing shortages, the doctors we do have are overburdened, overworked. So what could we do? What can we do? Could we use artificial intelligence to step in to help? Dr. Danielle Martin joins us today to talk about the role of AI and what it could do in the future of our healthcare. Good morning to you.
Good morning.
It is fascinating, right?
It's so interesting, and there's lots of potential.
Yeah, so let's talk about that potential. One of the areas that takes up a lot of time for doctors is the admin work, right?
Yeah.
It takes a lot of time. People don't have the staff for it. How could AI help with that?
Well, a great example is in generating and writing up our clinical notes. So if you come to see me in my office and we have a conversation after you leave, first of all, while you're in my office, I'm probably typing away on my computer, and then after you leave, I'm staying late to finish those notes. There are now AI scribes that essentially listen to the conversation, of course, with the patient's consent, and then write up that note for me. So at the end of our encounter, I just have to quickly review it, and that can save hours, at least estimates at least an hour a day of a doctor's time, which is time I could spend seeing
another patient, potentially.
Another patient or two or three or four,
right,
or make it home for dinner.
And just to be clear, I mean, this technology, it's not just transcribing the conversation.
It's interpreting the information. So it's more than just a voice to text. It's interpreting and taking our conversation and generating a well-organized medical note of the kind that I would be writing. Now, of course, I have to review it.
Of course, yeah.
You know, you always want that human in the loop.
Yeah, and also to point out, which you said as well, is like everybody knows in the doctor's office, when the typing is happening, there's a lack of eye contact.
That's
you can
right.
connect more.
I mean, that's what we all want. You
right.
want that as the patient.
That's
I want
right.
that as the doctor, to have that, you know, unencumbered human interaction.
Right.
But I won't remember everything if I'm not taking some notes as we're going, and also the workflow is impossible. So the AI scribe is a big one, and I have colleagues and friends who are implementing them now in their offices, and they say it's life-changing in terms of the joy that they have in their clinical work. So I'm excited to try it.
Yeah. What about referrals? How could AI
Similarly with referrals. So, you know, if you come to see me and I think that you need to see a specialist of some kind, there are programs that can say, okay, well, you live in this location. Who are all of the specialists within a 30-kilometer drive or whatever where you live, that can offer that service and automatically generate a referral note, which is another big administrative burden for family doctors, is the process of generating those letters and sending those letters and finding the right specialist who can deal with that issue. AI can take care of all of that. And so, you know, we're not there yet. These things are being, you know, slowly implemented over time, but the potential on the administrative side is tremendous. Not even to speak of the clinical side, which is really also exciting.
What about prescriptions?
Yeah, so prescriptions, you know, now we're getting into clinical work. So whether it's a chat bot that is your first point of contact in the office giving you basic advice, or whether it's the AI giving me advice about what prescription might be most likely to work for a patient given their other conditions. Now we're getting into the AI sort of being an extension of your doctor. And there's, of course, lots of caveats and protections we have to put around that, because we know that these machines are not as good as a clinician, but, you know, tremendous potential to extend our capacity to do that work, because, of course, I can't know everything.
Right.
We know, for example, that there are AI programs that can read a chest X-ray as well as or better than a radiologist, because they can absorb all the information from every chest X-ray that's ever been done or whatever in 3 seconds.
To hold that knowledge.
Yeah.
Now, you haven't implemented this technology yet. What's holding you back?
Well, I mean, those more complex ones have to be approved by Health Canada, but even the simpler ones are going to require investment. They're not free, and they require, in order to be effective, they need a lot of data, and we need to get our data systems talking to each other. There are also ethical considerations. The machine learning is only as good as the data you give it. And so we have to make sure that we're including data that represents our full populations. Otherwise, they can kind of learn in the wrong direction and give us advice that's not relevant to the populations we're serving. So lots of things that have to be carefully thought through, but lots of potential.
Well, and that's the thing. It's really fascinating and quite exciting. Dr. Martin, thank you for being here today.
Thanks for having me.
Appreciate it.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.